Hi all. Blessed morning to one and all present here. First of all, let us close our eyes and thank God Almighty for providing us such a beautiful day and giving us so many blessings in our lives. Amen. So, as we all are waiting very eagerly for today's session, we have our dear student faculty as Celine, Antony. She is currently working in Oman and she's working as an intensive care nurse, and she has 7 years of experience and she was with our Edu Skills family. And dear Celine, we together from the Edu Skills family want to give you a hearty welcome and want to congratulate you for cracking your OET in the first attempt. God bless you. And we are super excited to have you with us as a student faculty. We would like to thank Father for giving us such a wonderful opportunity and for allowing us to introduce to these people who can be a motivation to us also. I would like to welcome Saleen Sujit. Please come and over to you. God bless you as you impart your knowledge to all of us. Thank you.
Thank you, Jenny, for sharing this platform. A very good morning to all. I'm Celine Antony, currently working in Oman. I recently cracked my OET in first attempt, and I'm really grateful to God. And I'm remembering, at this moment, I'm remembering the person who taught me this OET, Aishwarya ma'am. Then my actually, I have studied with my friends actually, and CG brother from this family, and one Elizabeth also. I really thank all for the wonderful experience that I had with you all. Thank you all. Let's start the session first. So today I'm going to deal with OET writing. First, before starting the session, there are 4 modules in OET. That is reading, listening, writing, and speaking. And third exam part is writing. There are different types of letters, and there are different parts of an OET letter. So this all things you might be knowing because you are in this field for several years, and you are working out on this letter writing. So I'll just go through the introduction. That is, in an OET letter, we will be first starting with, sometimes some people will start with address, and they will second they will be writing the date. Some people will be starting, both are correct actually. So you can start with the date or with the address. So I'll just go through fast because you know already these things. First we will be writing the address, then the date, then the salutation, then the reference, who we are referring, the patient name and the age we will be writing. Then we will be using the first paragraph will be the introduction, and subsequently we will be using 2 or 3 paragraphs. In this it is written 6 paras. No need to write 6 paras. We won't be getting that much time to write this many paras also. So in the first para we will be writing the introduction, and second and third we will be concisely writing the admission part and the patient treatment, past medical history, social history, which is relevant for the case note. And we will be ending the session by that is mainly 2 things can be used for the end notes. That is, yours sincerely or your faithfully. That will be dealing in later. Hope you have understood what I'm trying to say. There are different types of letters in OET. Mainly we can classify like this. Different persons will be having different types of classification methods. I used to do like this. That is, there is a referral letter is there, transfer letter is there, home visit letter will be there, then non-case and discharge letter. These are the major types of letters. And in the OET writing, whenever we are starting to write the letter, we have to first check whether it is a non-case or an unknown case. Based on that only we should start the writing. That is the main thing. because two types are the main thing we have to check. Because on non-case we will be writing what all information which is needed for that recipient, that will be writing. For the unknown case, we need to pick up what all are the relevant information which is unknown to the recipient, that we have to check. Okay. And this is a letter format. I know already that you are familiar with all these things, and father has done wonderful videos regarding the OET, that usage of that ISBAR method. I'm not going that in detail regarding the ISBAR. You all know, I know. So we will be just going through each paragraph, how to write, what all things we have to remember, that we will be dealing. And in that we will be applying the principle that is formulated by the father sharing, that is ISBAR formulation, that how we will be applying in the case note. So this is the letter format. We will be writing the address, dates, salutations, and the reference. Then we will be writing one introduction para. Subsequently, we will be writing 2 or 3 paragraphs, which we will be writing the relevant information. And after that, we'll be writing the closing paragraph, and then we will be signing off. It is as simple as like written it here. So you can do it, but be confident and do it thoroughly. Okay. And the preparation, regarding the preparation, total time for the OET writing task is 45 minutes. In that, 5 minutes we will be getting to read the case note thoroughly. That you have to use it wisely, because if you are not read the that case note properly, you will be missing so much relevant points. So that 5 minutes you have to actively and concentrate. You have to read it with full of concentration. Otherwise, you can lose that task. So better, the first important thing is to read it properly. And the next 40 minutes is our running time. That is writing tasks. We have to finish it based on the relevant case note. I'll be dealing with how to select the relevant notes and how to ignore what all other things. I will briefly tell regarding that. Use your reading time very effectively. And in the case note, we will be get the writing, the whole letter, we will be getting case note and the writing task. That is, case note is which will be starting after that introduction, from the patient identification till the recommendation paragraph. That is the case note. And the writing task is the end of the case note. You can see writing task. Whenever you are getting the letter, first you have to concentrate on the writing task. And whenever you are taking the writing task, you have to keep in mind mainly 3 things. Who is the reader, and what is the purpose of the letter, and check the type of the letter, that is whether it is a non-case or unknown case. Am I clear to you? I hope you are understanding, or am I too fast?
No, Celine.
Okay.
It's clear.
Okay. Okay. And in the case note, when we are getting that case note, we have to identify what all are the things are relevant and what all are the irrelevant points. And whenever you are writing a letter, it should be written based on the perspective of the reader. Don't write, because first time when I just sharing one experience with you. During the first time when I'm writing the letter, it was too difficult actually. It will be for everyone, it will be like that. It was too difficult, and in a week I actually lost the hope, and I want to quit this OET. I don't want to continue like that, I thought, because it was difficult for me at the initial stage. But thanks to Aishwarya ma'am, actually she helped me and she motivated me how to write those things in a proper way. Actually, we have to check whether the points are relevant or not. That based upon the case note we will be discussing. That the relevant points and the irrelevant points will be based upon the whom we are writing the letter. If you're writing a letter to a social worker, the main points that has to be included should be the social history of that patient. That you already know. I know that you already know that. And if you're writing a letter to your known GP, that is a non-case, that is your own GP, that if you're writing a letter to your own GP, you have to focus on things like you have to pick up the present things that which is unknown to the recipient. So that is the relevant point will be in that known case, and the irrelevant points in that non case will be patient past medical history, details regarding the patient parents, all these things, and the patient past medications. These all things will be known to a GP. That is, it is patient's GP. So obviously he will be knowing all the relevant information that is pertaining to that patient. So that should be avoided in case of non case of letter. Then whenever you are writing the letter, you have to categorize into important, less important, and unimportant things. That is, when I started writing my letter, initially I used to read it fast and just start writing. Usually during the first time of my writing experience, I used to do like that, but don't rush. Whenever you're getting that 5 minutes, you have to read properly and you have to mark whether what is the important point, less important point, and unimportant point. The points which is not relevant to the letter should be ignored. So you can use the method like by ticking on the important points and by putting the cross mark on the unimportant point. So if by putting the tick mark on the important and less important point, you can I used to do like one tick plus one mark will be also kept there because it is less important point. And for the important point, I used to tick. It is an important point because when we start writing, we will miss some of the important point. At the end only, we will be knowing that we missed some of the important point. So to avoid that, during the time of reading itself, you have to put a tick mark, or you can use your own, you can adopt your own method. If you want to put any other symbols, you can put, but do it properly, because if you're doing it on my experience, it is better to put it so that you will be identifying the relevant points and you won't miss that point. Hope you have understood. And just remember, when you are writing a letter, just think that it is a formal letter to another healthcare professional. So try to avoid using informal words. If you're using the informal words, you can lose the marks. So always try to use the formal letters. Like don't say like can you ask, like that, or words. Don't put it in the letter. Can you just check? Those are the informal words. So it would be requested. Like that you can put. It is a formal word, so it can be used. And whenever you are converting the note form, try to put as a meaningful sentence. That is, whenever you are putting a case note into a sentence form, try to include all the things. Like you have to remember that whenever you are using a sentence, you have to put the subject and you have to put the verb, what action is doing in that subject, whether we are scheduling an appointment, whether you have done one procedure. That action should be must, it has to be written. Along with that, you have to take care of regarding the prepositions and articles you are using. Put the comma in a proper place, put the full stop on the proper place, then use your prepositions in a proper way. Use the, whenever you want to use if it is the right place, you have to use the a, like that you have to use. And avoid making a complex sentence. It is better to use a simple sentence, because if you're using a complex sentence with a lots of connectives, it will be difficult for the reader to understand also. And the second thing, we will make mistakes on complex sentences. And one thing, you can use complex sentences, but use it in a proper way. Use a proper connective and use the which is accepted by the OET. You can use the abbreviations. Like, for example, you cannot use the connectives like moreover, furthermore, because these are used previously, but now it is banned. Nowadays we are using consequently, then therefore, but, like that we can use. That we will be dealing in the discussion part. And whenever you are writing a letter, think there are certain things that you have to remember. That is, you have to check on the sentence construction. I already told you that what all things you have to include, like you have to use the subject, you have to use the connectives properly, you have to use the prepositions, then you have to use proper verb, and what are the things, that is, avoid using abbreviations. These are the things you have to take in mind whenever you are constructing a sentence. And when you are doing the case note expansion, all these points should be included, and use of a proper grammar. I can tell you that I'm not that good at grammar, but I can use the by checking on the case note, I can sense that this is the right way to. By practice only, you will be knowing more regarding that one. Then you have to use the proper sentence set. If you're using a simple tense like present simple tense, you have to properly lay out in a proper way. Avoid making, for example, if it is a current situation, you can use the present tense, that is present simple tense you can be used, um, like for example, if the patient it is a past tense. If the patient has any breathing problem like that, you can write he has breathing difficulty. It is a simple present tense that you can use. If it is a past tense, you can use I know you already know regarding that had we can use. If it is an ongoing situation, you can use has had, like that. These all are the basic things that you will be applying in a OET. So that all things you have to be familiar before going into the task. Then it is best to use a passive sentence when you are writing the OET letter. That is, there are mainly two types of sentences that you already know. I know that there are mainly active sentence and also passive sentence. In the active sentence, we will be using the format like subject, verb, and the object. That is the format. Like, for example, Maya written OET exam. That is a active form. When you are converting it into a passive form, you have to think that here the more importance will be given to the object. That will be the more important. That is OET exam. It is a past thing, written. It is a past thing. So OET exam was written by Maya. It is a passive sentence. So whenever you are getting the case note, you have to change that sentence into the passive form. Some of the people having the tendency to take the same case note sentences we will be picking up and directly putting on our writing task. We can use in certain situations. Sometimes we will not be getting some synonym word for that. But in that case, better to avoid the case notes, that is directly using that case note which is in that writing task, putting on your writing task, putting on your writing. So better to avoid like that. Okay, I hope you understood. Then use of complex sentences. I told you, if you're confident enough to use a complex sentence, like using the connectives and all, then you can use the complex sentences. And whenever you are writing, avoid using judgmental sentences. For example, in the case note, it is written that patient is alcoholic. Matthew is alcoholic. Like that it is written. Whenever, if you're writing like this, that is Matthew Matthew is a smoker. If you're writing like this, it is a judgmental sentence because we are judging his action. So try to avoid that. We can write like this: Matthew has a habit of smoking. It is, we are not judging, we are telling that he has a habit of smoking. So try to use like that. And whenever using a case note, there will be lot of abbreviations in the OET. You can use the abbreviations, standard abbreviations which is accepted by the OET. But in that sometimes it will be written like EV, that is for evaluation, RE for reference. But when you are writing, don't write such short forms. And we are having the tendency of I know in Kerala we are doing the documentation in a written manner. So in that we will be using patient like PT. So we have developed some of our own abbreviations. Try to avoid such abbreviations when you are writing a OET letter. And whenever you are using the abbreviations, use it carefully. And I already told you that avoid the informal connectors like moreover, furthermore, besides, meanwhile, that you already know, I know that. And do not copy from the case note, that I already told you. In certain situations, we have to copy from case note because we don't get the synonym and all. In that case, sometimes we will write, but try to avoid it. In case if we are writing one letter from that case note, it won't matter. I hope so. So you can use like that. Now we will be having a discussion on the OET case note. This will be a discussion session. So we'll be interacting with each other so that we'll be getting more ideas regarding that. Okay. So let's have a discussion on an OET writing case note. I'll be sharing you one case note. This is a robot. You can read by itself if you want to read it. I'll just read it so that uh, it will be easy for me and you also. So Robert is a patient and 64 year. In that, whenever you are reading the case note, you can use the ISBAR format, which has been taught by Father Shireen, because in that we will be checking on the identification data. In that, we have to check what all are the identification data we have to choose, because it might have lots of information which is not relevant for the situation. So we will be using the identification data. Then what is the present situation of that patient we will be using. Then what is the background of the patient. If it is a non-case, we have to avoid using so much of background information because already the patient might be knowing that one. Okay. Then we will be, what is the assessment of the patient, that we will be getting from the case note. We will be it will be there like the patient was admitted with visas, maybe breathing difficulty. That all are the assessment data we can find out, and whatever it is relevant for the case note we will be picking up. Then finally the recommendation part, that we have to written in a proper way, because that is the part I think that is the easiest part for writing a OET letter, and for me also it was the easiest part than the other paragraph. Other paragraphs are also easy if you are using a proper format. Okay, so I'll read through this. Name is Robert Griffith. Then he's a divorced, 13 years, and lives at Bunburg Nursing Home, 12 years, and two children he is having, and he's having the hobbies like singing, playing guitar, slight memory loss observed, history of asthma since infancy, possible environmental allergies, presented with a progressive wheezing and respiratory distress for the past week. That is the medical history, and the admission date is irrelevant for me. That we will be discussing. Admission date is there, discharge date is there, and medical examination, that is tachycardia, patient having some issues. That is tachycardia is there, tachypnea, inspiratory, expiratory wheeze. Then we got the diagnosis, that is patient is having bronchitis, pneumonia and bronchitis, and the medication which is prescribed for the patient, and nursing management, what all are the things that they have done, and the discharge plan. Everything is there. And the discharge plan is the recommendations that we will be using in the end of the paragraph. That is, they have, he has to continue with a nebulization with Saleen, adequate rest has to be there, deep breathing exercise, increased fluid intake, then continue medication. And first, I forgot, I already told you that whenever you are reading a letter, you have to first go through the writing task. Sorry that I missed. Actually, according to the slides I went, this is the writing task. Using the information given in the case note, write a discharge letter to the nursing manager at the Bunburg nursing home. In your answer, expand the relevant case note into the complete sentences. Do not use not form, use letter format, and the letter should be approximately 160 to 200, like that it will be written, or 180 to 200. That is the writing task. Hope you have understood the case note. Do you want to go through again?
Understood, Celine. We have understood.
Okay. So let's have a discussion on this case note. Okay. So one at a time, because if we are doing it in a because we are a group. If you're doing it, everyone is talking at a time, it will be disturbance for everyone to understand and all. So first we will be dealing with this case note. By this note, you already read this one, right? So what is the type of this letter?
Discharge letter.
It's not
Yeah,
known
it's
letter.
a discharge letter. Right. I don't know who told that, but it is a known case. That is the main point when you are checking on this letter, because it's a known case, so we can ignore certain points, the certain irrelevant points we can ignore. So I'll just go through the letter. You can tell what are the relevant points and irrelevant points. Okay. Name and marital status. Is it first we will go through, we will take name. Is it the relevant thing? Yes,
Yes.
right. Yes, because in the reference we have to write it the name, right? And the age is also an important factor. We will be writing that one also. Is the marital status is a relevant thing in this case? Not?
No.
No, because this is a known case, because we are shifting to the same facility and we are writing to the nurse manager. So she already might be knowing regarding the divorced status of him. So there is no need for that. Then the social background, lives at that nursing home for 12 years and 2 kids, and regarding the hobbies. Is that needed?
No.
No.
No, because social background is not relevant in this case, not because already the patient is in that nursing home, they might be knowing regarding all those things. And next one is the medical history. History of asthma since infancy, possibly environmental allergies, presented with progressive wheeze and respiratory distress for the past week. Is it relevant? What are the things we can take from that?
Presented with the progressive wheezing and respiratory.
Yeah, that's a right. That's right. That is, we have to take that one only. The presented with progressive wheezing and respiratory distress for the past week. That is the main thing we have to take. And the history of asthma, because already the nurse manager might be knowing regarding that, and the allergies also he might be knowing regarding that. So no need for that. Sorry. Then admission date is actually required for us, because in the sorry. So in the admission date is needed because, sorry, I'll just silent my mobile. Sorry for the disturbance. Okay. The admission date we need to know, because in the, because the writing task, we will be writing the date. If the, no, in the admission date, sorry, I got little distracted. In the case note, we will be writing the admission time and admission date we will be writing. And the discharge date is also relevant, because in the date of the exam, might be we will be using the discharge date that we will be using. So discharge date is also relevant one. And regarding the medical examination, is it relevant?
Yes.
Yes.
Relevant.
That is a relevant point, because after admitting, what all the things patient might experience, that we need to write in the case note. And the diagnosis also we need to write in the case note. And regarding the medication, what are the treatment which has been given, because we have to tell them, because it is a nurse manager, she has the right to know about that, because sometimes some medications need to be continued, so it has to be written. And it is a small case note, it is better to write, because otherwise we won't be getting enough sentences on that. So we will be writing that one. And regarding the nursing, all these things, that is the nursing management and the discharge plan, we need to write in the case note, because all these things are the relevant thing. Whenever you are taking a case note, like if you are writing to a letter to a community health nurse, mainly the last paragraph should not be ignored, because the recommendation para and the previous para will be with lots of information. If the case note is big enough, we will be definitely missing lots of points in that. So I already told you in the previous, whenever you are writing, you can put tick mark, so that you will be getting information what all things has to be added. Okay. So
Sister,
we have gone through, yeah.
Sister, in this case note, the admission date, it is not new to them, no? Means it is they also knows that the patient is admitted. Then we
Yes.
it's like a mutual understanding. We can write that as you aware or something like that.
Yes, we can write that. It is a correct point actually. We can write that because in the second para, in non-case, we will be writing like as you are aware, the patient was admitted with like that written. But for a completeness, we can write the admission time, admission date. It's okay, no issues on that. We
Okay.
can write.
Okay.
It's okay for that because
Okay.
as the case note is very less content, we can write it because otherwise our sentence will not be complete and the content will not be that enough because we won't be reaching up to at least 150 words. So it is better to write. No issues in that.
No, my point is that not I understood, sister, what you told. What I am asking is that the admission date is new to them, so that we can make a it's a mutual understanding. We can write instead of writing he was admitted to the hospital in this dates, it is not new to them, so they knows already
Yeah,
that
I
patient is
understood your point. You are
okay.
right. You are right in the sentence.
Okay.
In your, but we can also write like that. I told. In some
Okay.
certain situations, we will be writing.
Okay.
But I prefer to write because for the completion, I prefer to write. Whenever I was writing, if it is a non-case or unknown case, I usually write my admission date. It's okay. I think so.
Okay.
Your
Okay.
point
Okay.
is also right.
Okay.
You can continue like that also. Okay.
Okay. Thank you, sister.
So first, okay, we are not yet finished. We will be going through how we are going to write this letter. Okay. So first, we will be going through the first thing will be the address. So the address in the case notice, we are writing the letter to the nurse manager and the nursing home we will be writing. Okay. And second one will be the discharge date. Already the discharge date I have shown it, that is 22nd September. I think it is 2018. So we will be writing that one. And third one will be the salutation. Dear nurse manager, we will be writing because there is no name of nurse manager in that. So we will be writing like dear nurse manager. We will be putting a comma after that. Then reference, we will be writing the patient name and age. So many different methods. Everyone using different formats. I know. I usually use like aged 74. If it is age is 74, it is 64, then age 64. You can also write like capital A. If aged, you can write like a small a and aged. If you are using an age, then it should be capital A, G, E, and the year you have to write. And you can also write the date of birth if it is provided, but better use years, that age, it is better to use that one. Then that is the reference part. Then the actual point, that is the introduction part. This is the main important thing. If your introduction goes wrong, everything goes wrong because we have to pick a proper introduction. Usually most of the people will spend more time on introduction part. Sometimes it might lose the time for the writing task also. But whenever you are writing, whenever you are reading the case note itself, you have to think in mind what are things you have to write. Already Father Celine has already Father has done a wonderful video regarding what all things has to be written in the writing task. I'm not going that much detail because it will take more time to discuss that all things. But you have to follow that one. It is better to follow that one. In that, mainly three things we have to write. What are the three things? The purpose has to be written. Then, what is the condition of the patient has to be written, and what else? If the patient has to be transferred or discharged, that thing has to be mentioned. These are things has to be come on the introduction part, right? Anything you want to add? As it is a discussion, you can also actively participate. No issues. So in introduction, so we will be using all these things. Some persons will be, because different persons are trained in different institutions, so all will be having a different style of writing. I personally write like I'm writing to refer, like that we will be writing. Sometimes they will be initially using the purpose on the first on the introduction paragraph. initially. ഞാൻ പറഞ്ഞ മനസ്സിലായെന്ന് എനിക്കറിയത്തില്ല, എനിക്കത് പറഞ്ഞ് ഫലിപ്പിക്കാൻ പറ്റുന്നതുകൊണ്ട് ഞാൻ മലയാളം പറയാണ്. യൂഷ്വലി നമ്മൾ ഇൻട്രൊഡക്ഷൻ പാര എഴുതുമ്പോൾ ആദ്യം ചിലർ പർപ്പസ് വെച്ച് സ്റ്റാർട്ട് ചെയ്യാറുണ്ട്, ചിലര് എന്തുവാണ് പേഷ്യന്റ് കണ്ടീഷൻ വെച്ച് സ്റ്റാർട്ട് ചെയ്യാറുണ്ട്. ഏതും യൂസ് ചെയ്യാം, ഏത് യൂസ് ചെയ്താലും തെറ്റൊന്നുമില്ല. പക്ഷെ ഞാൻ യൂസ് ചെയ്തുകൊണ്ടിരുന്നത് നമ്മളെ എന്തുവാണ് പേഷ്യന്റ് കണ്ടീഷൻ വെച്ച് യൂസ് ചെയ്യാം. ഇതൊരു നോൺ കേസ് ആയതുകൊണ്ട് തന്നെ നമ്മൾ യൂസ് ചെയ്യുന്നത് എന്തായിരിക്കും? ഐ എം റൈറ്റിംഗ് ടു അപ്ഡേറ്റ് യു റിഗാർഡിങ് എന്തുവാ പേഷ്യന്റിന്റെ പേര് എഴുതുക, എന്തുവാണ് പേഷ്യന്റിന്റെ കണ്ടീഷൻ. അപ്പൊ നിങ്ങൾക്ക് ആർക്കെങ്കിലും ഒരാൾക്ക് പറയാമോ വാട്ട് വിൽ ബി ദ ഫസ്റ്റ് സെന്റൻസ്? രണ്ട് വേയിലും പറയാം. പർപ്പസ് വെച്ച് പറയാൻ എനിക്ക് തോന്നുന്നു ഇതിനകത്ത് ആരൊക്കെ ഉണ്ടെന്ന് എനിക്ക് അറിയത്തില്ല സത്യം പറഞ്ഞാൽ. ഞാൻ എല്ലാവരുടെയും പേരൊന്നും നോക്കിയില്ല, എന്റെ സ്ക്രീൻ മാത്രമേ ഞാൻ നോക്കിയുള്ളൂ. ഓക്കെ, സിജി ബ്രദറിന്റെ സൗണ്ട് കേട്ടോണ്ട് ഞാൻ സിജി ബ്രദറിന്റെ അടുത്ത് തന്നെ ഫസ്റ്റ് ചോദിക്കാം. എന്താ സിജി ബ്രദർ, ഫസ്റ്റ് നമ്മൾ സെന്റൻസ് എഴുതുമ്പോഴത്തേക്കും ഇപ്പം സിജി ബ്രദറിന്റെ വേ ഓഫ് സ്റ്റൈൽ എനിക്കറിയാം. സിജി ബ്രദർ പർപ്പസ് തൊട്ടാണ് ആദ്യം സ്റ്റാർട്ട് ചെയ്യുന്നത്. അപ്പൊ നമ്മൾ ഈ ലെറ്റർ എങ്ങനെയായിരിക്കും പർപ്പസ് വെച്ച് എഴുതാനായിട്ട് വരികയാണെന്നുണ്ടെങ്കിൽ, ബിക്കോസ് ദ പർപ്പസ്, ഒരു കാര്യം ഞാൻ എടുത്ത് പറയാം, whenever you are writing the purpose of the letter, what all things which is mentioned in the case note should be written like that. ഇപ്പൊ നമ്മുടെ കേസ് നോട്ടിനകത്ത് എഴുതിയിരിക്കുകയാണ് ഫോർ ഫോളോ അപ്പ് കെയർ എന്ന് എഴുതിയിരിക്കുകയാണെങ്കിൽ മാത്രം അതെടുക്കുക. അല്ലാതെ നമ്മൾ ചിലപ്പോൾ പേഷ്യന്റ് ആ പർപ്പസിനകത്ത് എഴുതിയിട്ടുണ്ടായിരിക്കും ഫോളോ അപ്പ് കെയർ എന്ന് എഴുതിയിട്ടുണ്ടാവും, പക്ഷെ നമുക്കൊരു ഫോർമാറ്റ് ഉണ്ട് ഫർദർ കെയർ ആൻഡ് മാനേജ്മെന്റ്, നമ്മൾ ചിലപ്പോൾ എഴുതി പോകും. ബിക്കോസ് നമ്മൾ അങ്ങനെ യൂഷ്വലി ഇപ്പൊ ഒരു സെയിം ഏജൻസിയിലോട്ട് തന്നെ നമ്മൾ ഷിഫ്റ്റ് ചെയ്യുന്നത്. അപ്പൊ നമുക്ക് വേണമെങ്കിൽ അങ്ങനെ എഴുതാം എന്ന് വിചാരിക്കും, പക്ഷെ അങ്ങനെ എഴുതാൻ പാടില്ല. കാരണം കേസ് നോട്ടിനകത്ത് എന്താണോ പർപ്പസ് പറഞ്ഞിരിക്കുന്നത് ആ പർപ്പസ് തന്നെ ആയിരിക്കണം ഫോളോ ചെയ്യേണ്ടത്. അപ്പം ഈ കേസ് നോട്ട് ഞാൻ മുമ്പേ വായിച്ചത് കൊണ്ട് ഞാൻ പറയാം, അതിനകത്ത് പർപ്പസ് അതിനകത്ത് അവരെടുത്ത് എഴുതിയിട്ടില്ല. ഡിസ്ചാർജ് ലെറ്റർ എന്ന് മാത്രമേ അതിനകത്ത് എഴുതിയിട്ടുള്ളൂ. അപ്പം പേഷ്യന്റിന് എന്തായാലും നമുക്കറിയാം പേഷ്യന്റ് നോൺ കേസ് ആണ്, അല്ല അവിടുത്തെ ഫെസിലിറ്റിയിലോട്ട് ഫോളോ അപ്പ് കെയറിന് വേണ്ടിയിട്ടാണ് തിരിച്ചു പോകുന്നതെന്ന് അറിയുന്നതുകൊണ്ട് നമുക്ക് വേണമെങ്കിൽ ഫോളോ അപ്പ് കെയർ എന്ന് എഴുതാം, അല്ലെങ്കിൽ ഫർദർ കെയർ ആൻഡ് മാനേജ്മെന്റ് എന്ന് എഴുതാം. മാനേജ്മെന്റ് യൂഷ്വലി ഡോക്ടേഴ്സിനാണ് എഴുതുന്നത്. ഫർദർ കെയർ ആൻഡ് അസിസ്റ്റൻസ് നമുക്ക് വേണമെങ്കിൽ എഴുതാം. ഓക്കെ, സോ സിജി ബ്രദർ മ്യൂട്ട് ആണ്, എനിക്ക് സിജി ബ്രദർ മാത്രമേ കാണാൻ പറ്റുന്നുള്ളൂ.
Celine, could you please change your language to English back again? There may be non-Malayalis.
Yeah. Okay, sorry for the inconvenience. Okay, I'll tell. So if you're writing, it is I already told that it is a non-case. So my style of writing is like this. I'm writing to update you regarding patient name is Miss Griffith, right? Griffith, who is recovering from bronchitis and pneumonia. That is the diagnosis of that patient, and I will be putting full stop for that because I don't use complex sentences on the introduction paragraph. It is my personal choice. If you're clubbing the purpose and the diagnosis of the patient together, it is okay. But I taught like that because I usually break down the sentence and make it as simple as it is. So first sentence I will be writing like that, and the purpose I'll be writing like he requires further care and assistance, and he is being discharged on the date. It is already written that it is today, so he is being discharged today. That will be my introduction. If you have any further opinion, you can also raise the hands or you can speak out regarding the introduction, so we can discuss. If you are discussing, we'll be getting more information regarding that. We'll be getting more ideas. Anybody want to discuss? I think I might need help of father also. I think hope he's here also.
I am here. Yes, I am here. Cool.
Yeah,
I am
okay,
here.
father.
Yes.
Okay. Nobody is talking. That is why I know because
maybe excuse me. Maybe you can complete yourself, and we'll ask them to ask questions. We'll have a Q&A session at the end. You want to complete the whole thing?
Okay.
Celine, we all are here.
Okay.
Yes.
Okay, complete your task first.
Yes.
Thank you.
Okay, then the second paragraph will be, already I told that it is a non-case, and previously one brother told that we will be writing the letter with as you are aware. Like that we can write, and also we can write like as you know. Like that we can write as you know, comma, this patient name Griffith was admitted to the hospital I usually prefer to write the date on 10th September with the aforementioned diagnosis or above mentioned diagnosis. Whatever you can use, you can use. That will be the first one. And I'll write like on the initial examination or initial assessment. He already had, because now the patient is recovering, so he might not be having all those symptoms. So he had breathing tachycardia. I think he had tachycardia. I'll take my case note also so that I can also go through that. He had tachycardia and tachypnea. In addition to that, he had bronchi and inspiratory wheeze was there. So we can write like that. Then consequently, full stop. That sentence is complete. Consequently, he was treated with or he was commenced on either medication, what all the medication which patient had taken, like injection amoxicillin and dariflin, I think, which thrice daily. And I think the dariflin needs to be continued. In the recommendation para, it is written. So we can also quote here dariflin, which needs to be continued. Full stop. That is my second paragraph. It's finished. Because as it is a smaller case note, I know you might be having some different opinion that we can discuss in the discussion time. Then the third para will be the current status of the patient. So we can start the sentence with presently, or currently we can also use. Presently, Mr. Griffith, okay, Griffith has poor prognosis, good prognosis as evidenced by what are the things which is there for that patient. I think the cough has been reduced or breathing difficulty has been reduced. I think in the progress note it is written. So we can use all those things also. Okay. Other than this, there is no such information in the case note to discuss, to write. So better to stop like that. Or else you can write already the patient has a history of asthma, right? We can also write like this, like patient has an established history of asthma. It is not that relevant because it is less important because already it is a known case. Already the nurse manager might be knowing, but better to write because if the content is less, we can also include 1 or 2 points extra. Okay. And we will be writing the third paragraph like in the view of above, or it would be greatly appreciated, not greatly, it would be appreciated if you could all the recommendations we will be writing in a proper way. In that we will be using sentences like it would be appreciated we can use, but better to avoid because it is a template. So if you're using templates, they will be understanding. So many people will be using templates. Templates is a sentence which is already written format. There will not be grammar mistakes will not be there. So you can use the templates also, or else you can start with please or kindly. You can use kindly instruct Ms. Griffith to take adequate rest as well as increase his fluid intake. Like that you can write. It's okay, no issues at all. Or you can mention please note he has to please note he has to take the medication. Like that, if the medication is there, that you can also write in the sentence. 3 things we will be using. Please note, it would be requested. Not 3 things. Please note, kindly, it would be requested. Then it would be appreciated. That all the sentence construction sentences will be for the recommendation paragraph. It is better to use like that because whenever you're writing the letter, you have to use in a polite manner. Okay, then we can end this like if you have any further queries, please do not hesitate to contact me regarding what the patient name that you can also write. Then we will be using the end note like yours faithfully because as no name is written there because it is written like nurse manager. So we can use yours faithfully and we can finish up the writing task. Hope you have understood. I think I open the session for discussion. I know different opinions will be there. Let's discuss together so that we will be getting a proper idea regarding that. Okay.
Okay.
Father.
Yes. Okay.
Yes, Celine, thank you. Thank you for the wonderful, informative class. Now the time is open for discussion. So the Q&A session, and if any one of you all have any queries or concerns, please put forward to Celine. Thank you so much.
Yeah, my name is Regina. Celine, can you please clarify this first in the introduction para? As you said, who is recovering from? What is that? Who is recovering from bronchial pneumonia? What if we write who was diagnosed with bronchial pneumonia and then he requests, I'm writing to update who so and so and who was diagnosed with bronchial pneumonia. What is the difference between who was diagnosed with bronchial
We can
pneumonia?
write like that also, but I prefer to write like recovering because because it is a past thing. Patient had that diagnosis. Currently, the patient is recovering from that. So I think the best to convey the recipient the present situation. So it is better to write like is recovering from pneumonia and bronchitis.
In case of discharge letter, we can write it like who is recovering from bronchial diagnosis. Diagnosis.
Okay, for a discharge letter, we can write like that also because was diagnosed with. Because if it is a doctor and all, we have to write like that only because who was diagnosed with. It is better to write like that because it's an actual diagnosis. So better to know regarding that. But I think in this situation, we can write like this also is recovering from. Both format you can use. But yeah. Is recovering also is act 1, but your thing is also right, but you can use like that also.
Okay, thank you, sir. And could you please clarify the beginning of second paragraph also? As you know, and as you are aware,
as you know,
cases, which are the cases where we can start with as you, if it is known case only
in the known case we will be using as you know or as you are aware. Otherwise we won't be using
in the beginning of second paragraph.
If it is an unknown case, we will be starting the session, starting that sentence with the patient name. If it is this patient is an unknown case, I'll be writing like Mr. Griffith. That patient name was admitted to hospital on this date with the complaint of this. That only I will be writing because it is an unknown case. They are having the right to know the condition of that patient. Here, the patient already that person know that this patient was admitted here on that date and with this complaint. So it is in the known case, it is better to use like this.
Okay, thank you.
Am I clear to you?
Yes. Thank you, sir.
Okay. Welcome.
Celine, good morning.
Yes. Good morning.
My name is Srilata. I want to congratulate you, first thing. And second, I want to appreciate you that you have spent a lot of effort to make us all update about this writing task. And I have two concerns. One is, do we need to mention the age of the patient in introduction para?
No need, because in the reference itself, we have written that name of the patient and age. Only the age of the patient is for age.
No need of age. Okay.
Yes.
And
already
another
because
thing,
if we are writing the age again, and that is a repetition. So better to avoid.
Okay. And another thing, do we need to, is it a must to write in a complex sentence or compound sentence in the body part?
That I already told you that if you are well and confident enough to write a complex sentences using all the connectives, you can use it. No issues in that. But avoid using more 2 or 3 complex sentences in a letter. You can use 1 or 2 complex sentences in a letter. It's okay. But if you are
suppose if we don't write complex or compound sentences, are they going to penalize or?
Better use simple sentences, but at least once you can use at least once you can use the complex sentences. My point is that use the complex sentence if you are well and confident, because if you are using the complex sentence and making the mistake, you will be losing the mark. Right?
Okay.
So if you are confident enough, you can use the complex sentences. It's okay. It's good actually using the complex sentences because the reader might be thinking that we are well confident in writing the letter and we are having good knowledge on letter writing also. So it is better to use the confident, complex sentences. But if you're confident and well know about that time only you use that. That's my personal
Okay.
opinion. You can use like that.
Okay. Clear, Celine. Thank you.
Thank you. Thank you.
My name is Shinod. I really
Hi.
congratulate you and appreciate you that you have taken a good effort and it is very well explained and it's totally we understand. It is very simple manner you explained. Thank you very much.
Thank you.
Thank you, Celine, for sharing your valuable knowledge with us. And,
Thank you very much
for
for the
giving
wonderful
us a
section.
wonderful example. I'm sure it's very informative for the beginners and it was a good revision for the seniors. I want to thank CJ brother for his wonderful empowering attitude and everything, the way you empower others, especially as Celine has taken your name. God bless you, CJ brother. And I would like to
Thank you, Jenny.
I would like to thank God Almighty for giving us such a wonderful platform and want to thank Father Celine for every opportunity you give us to learn and improve our knowledge. Want to thank Soumya for every sincere effort she takes behind this platform. And I want to thank all the OET Celine once again, and we congratulate you on behalf of Edu Skills family.